Well, thank you very much for joining us this morning and today. On behalf of the National Collaborating Centre for Methods and Tools, it is our pleasure to have you here in Toronto with us today to talk about preventing childhood obesity. Today is really about giving you a snapshot of what is available in the scientific literature about what works and what doesn't work, what doesn't appear to be working around obesity prevention. So it's a snapshot of that scientific literature. That is really a small part of the day. The real goal of the day is to present that quite quickly to you in a very highly summarized way and really have all of you engaging in discussion and debate about what does that mean for you. Today we're focusing on two types of evidence, effectiveness evidence and evidence around SDOH factors. We know that there are many other types of evidence that go into decision making, and we're not diminishing the importance of those in public health decision making. We're just not focusing on them for today. The continuum of services that we have from healthevidence.ca through to the NCCMT, where health evidence is putting into one place the effectiveness evidence in public health, and NCCMT is really interested in helping public health put that evidence into practice as it is relevant, appropriate, feasible, applicable. What this model allows us to do is to start discussing what's missing, what's there, and certainly very much this model would depict that there's an understanding that the decision making we're all involved in with respect to public health is very, very complex. For us at the National Collaborating Centre for Methods and Tools, it helps us break down what are the skills that folks need in order to be able to work through this process.
So what I'm going to do is cover basically the playing field, or ask the question, what systematic reviews are currently available in terms of addressing the question of what works for preventing childhood obesity as well as increasing physical activity. And certainly navigating the evidence can be a difficult task. And we often wonder, where should we start? Where do we get going? Many of you would be familiar with the 7 best investments for physical activity. I've stretched it now and said for children. So where does the evidence lie?
So today, I don't have a lot of time, so I'm going to briefly cover the background of our EIDM process to develop a report, which the link is actually in the back, the very last slide, which is a review of the evidence, school-based interventions to address obesity prevention in children 6 to 12 years of age. We know that we're more successful preventing obesity versus reversing it. So we originally were looking at doing something within the general population, which was really broad. And so we had these internal discussions based on kind of what was happening, and basically decided we were actually going to focus in on school-based initiatives with children ages 6 to 12. And we really thought that with doing this report, it would be better for us to focus in so we could really have some usable recommendations in the end. From the literature and then from the expertise around the table, we took those kind of critical success factors and we put them in our 4 pillars of our framework for healthy schools, which is high-quality instruction programs, a healthy physical environment, a supportive social environment, and community partnerships.
We'll be talking about the health equity approach that we're using in Saskatoon Health Region, and then we'll be giving some examples of how the data itself has been used to influence our programs in the health region. So really the health equity approach that we're talking about and that we're using in Saskatoon Health Region involves 3 main components. So the first is monitoring health disparities and reporting on health disparities. The second is research into the causes of health disparities, but also into what works to promote health and to reduce health disparities. And then the third piece is taking action on the social determinants of health to promote population health.
I think what we need is trying to figure out how in our everyday work, in our work lives which are so busy and so challenging, how do we fit in equity? How do we make sure this remains on the agenda? So when we think about making some strides, what do we need to keep in mind? I'm going to highlight 4 things. Some of them have already been mentioned. I just want to talk about the importance of community engagement, intersectoral action, communication, and leadership.